Now, the Health Minister has pledged to enhance services at Ennis Hospital, but has given no commitment to emergency care in Clare. Minister Jennifer Carroll MacNeill has described a new strategic site acquired in Limerick to solve hospital overcrowding in the Midwest as HIQA's option B and C plus. The Minister described the €14 million, 43.8 acre site in Raheen as a strategic site for the Midwest health system for the next 30 years, located a 28-minute drive away from Ennis and Nenagh. But over 40% of Clare's population lives more than an hour's drive from their nearest ED. And the Minister said her vision for Ennis's progression is similar to that of Bantry General Hospital in Cork, which doesn't have an emergency department or indeed proposals for one. Despite this, Minister Carroll MacNeill insists Clare was at the centre of their plans in the Midwest. However, health campaigners here have expressed anger and deep frustration following the announcement of the site that has been identified for a new hospital campus for the Midwest. Indeed, the Friends of Ennis Hospital group claims 130,000 people in Clare, along with a further 80,000 in Tipperary, will see limited benefit from the hospital being located in the city. So, do you feel this is a slap in the face to the people of Clare, that it looks likely that there's going to be a second hospital, but it's going to be in Limerick and it's going to be very, very close to University Hospital Limerick? Let us know on 0818 400 964 or 086 1800 964. I suspect there will be lots of views out there and lots of strong ones as well. Whatever those views might be, do get them into us. But for more on this, I'm joined by two of our TDs, the Meelick Fianna Fáil TD Cathal Crowe and the Bodyke Fine Gael TD Joe Coonan. You're both welcome to the programme, gents. Cathal, this project being described as a strategic hospital site for the next 30 years of healthcare in the Midwest, but you heard what Friends of Ennis Hospital Group have had to say. It offers little or no benefit to the people living in Clare. So does this location genuinely improve healthcare access for people in County Clare, or are Friends of Ennis Hospital more on the money with their assessment?
Good morning, Alan. Thanks for having me on. Good morning, Joe. I have very mixed views on this. So I suppose if you look at this through the lens of the pressure that UHL is under, trolleys, people struggling to get into beds and struggling to get access to healthcare, then this will certainly alleviate that pressure, and I think that's a fact. But then if you look at through the geographical lens, which we have to be cognizant of as Clare TDs, there's a large swathe of our population living beyond Ennis, in the northern and western extremities of our county in particular. And I put it into my phone a short while ago, the village of Cross, back near Loop Head, with no traffic, it'd be about an hour and 40 minutes to Limerick. But with morning traffic and school runs and people going to work, it could be well over 2 hours. So for them, this announcement doesn't offer much comfort at all. And I think really what I want to hear now is more definite plans for Ennis, what it's going to involve. I think in the very short term, before we get into medium-term plans for Ennis Hospital, I think we need commitments from the Minister about improved access to ambulance care. And I think now that Sligo is getting an air ambulance, I think there's certainly the strongest case we've ever had to have an air ambulance operating out of Clare. You would then be in Limerick in a very, very short time, as opposed to 2 hours on the road. And that 2 hours, by the way, could be even longer if you're waiting for an ambulance to go back and get you. You could maybe add another hour onto that. And we've had many stories on your show, Alan, about tales of woe about how that has happened. So, look, it's mixed views. I would very much have preferred this to be in Clare. That's what I would have lobbied for. We all, as TDs in the region, put our shoulders to the wheel. We were told that a site within around 15 minutes of a commute from UHL could be considered. I stood up at a public meeting in the old ground last week, organised by Angela Coll and Deirdre Culligan, and I said to people, 15 minutes from Duradoyle does encompass County Clare, but it's not magic wand stuff. But what we've now gotten is
but Colin, can I just ask you on that before I bring Joe in? Do you think that the concerns and the distance that people in West and North Clare from just didn't factor into the equation, or did they look at the situation and say, look, it's a sizable geographical area, we're not going to be able to please everybody? They're mentioning the proximity to the bigger population bases, Ennis and Nenagh, and they were, as I say, they were never going to be able to please everyone, so they just went with the option that was closest to where most people reside.
So I got the sense over the years, and I think most people would probably have a similar assessment, that their first preference probably would have been to expand UHL within the hospital campus, but it's totally hemmed in. There isn't even a green area. You can't even park a car there at the moment. So a new site had to be looked at. The example of Leicester Hospital in England was given to us several times over, and in that hospital there's a motorway connecting the two, and you, depending on what service you need in the hospital or depending on what your health needs are, you go to one or the other. I would have felt that you could achieve that geographical balance quite well by putting something in County Clare. It would still be remote for some people in the county, but it would be in our county. And I buy into this argument, and I've long bought into it, that Angela Collins has presented, that other counties, Tipperary, for example, do have access to emergency care. Limerick have it, and Clare don't. And whilst this announcement is good in one aspect, because it takes pressure off UHL, the geographic aspect hasn't been adequately dealt with, and it's for that reason I'm calling on full clarity and sped up investment on these improvements in Ennis. And I would also say, Alan, that we're hearing from the Minister that they will decant a lot of the departments in UHL out to this new hospital site. I think decanting can work both ways. Why not bring some of those services, acute services, to Ennis? The campus there, the hospital campus in Ennis, can offer an awful lot more. But I think ambulance care and, as I said, air ambulance needs to be absolutely in the mix now. It cannot be ignored any longer.
And you have mentioned that. Let's bring in Joe Cooney. And Joe, you can see that there would be benefits from having a new hospital in close proximity to University Hospital Limerick, but traffic can be an issue in and around UHL. If this new hospital's proximity to UHL is that going to just exacerbate that particular problem and make it difficult for people to get into either hospital in a timely manner?
Good morning, Alan. Good morning, Cathal. Again, look, first of all, as we're well aware, in 2009, Ennis Hospital was downgraded. That time we were promised a centre of excellence, which unfortunately never happened, as we're well aware. Now we're gone into 2026. At least now there's a site picked for a no centre of excellence, we'll call it, going forward. It's close to the Morseway. My preference would be if it was closer to Clare, within Clare, but unfortunately it was to be with close proximity to UHL, which is understandable, and that was in the HIQA report. It is ideal. You're not going through the city of Limerick. You can actually access it from both sides of Clare, West Ennis and North Clare or East Clare, by the Morseway from both ways. It's off the Morseway, only 10 seconds off the Morseway. It's an ideal site, but as I say, it's disappointing it's not closer to Clare, but I think it's a step forward to push proper health services in the Midwest region and for the people of Clare, which we've been looking for since 2009. And at this stage, I want to compliment Sandra Broderick and the workforce in UHL that they have been doing over a long number of years with an increase in population and under severe pressure. There's great credit to the staff there.
Joe, you're highlighting a lot of benefits there to where this new site is. But I mean, prior to the acquisition of this site and the announcement of it, the official announcement of it, you would have your preference clearly would have been for a site in Clare, despite this site in Limerick having a lot of benefits.
Yes, and to be honest, Joe, yes, Clare was looked at, and in fairness to the team that was working on this, they did contact Clare County Council. They did get a number of sites close, within close proximity of UHL, but unfortunately those sites didn't work out to be suitable. This site is zoned and all, ready to go for planning when there's a design team put in place and a design done first. So it's going to speed up the process going forward, Alan, which is badly needed in the Midwest region and in the Clare region. We're well aware that there is serious concern back in West and North Clare, and I can see why there would be serious concern back there, Alan, because of the distance to travel. But in order to counteract that, we have a meeting set up for Monday week with the National Ambulance Service. It's a cross-party meeting to get a better ambulance service, and as Cathal mentioned there, also an air ambulance. We'll be looking at that as well going forward, because it is important for rural areas that's an hour and a half, 2 hours, whatever the case may be, away from this new facility, away from UHL at the moment, that when there's patients needed to be got there, that they can be got there in time, there's no delay, and that is something we'll be looking at as well to improve them services, which is vital and important for the people in those areas.
Yeah, and Joe, just before I bring Carl back in, I mean, ambulance service, increased ambulance services would be great, but that can only do so much, and this news will have been greeted with dismay in West and North Clare. The Minister promising enhancement for Ennis Hospital, and if there were a commitment to restoring an emergency department there, perhaps that would assuage some of the dismay in those particular parts of the county. But Minister Carroll MacNeill gave no commitment to restoring an ED there. Does that just compound the disappointment overall? Do you think that enhancements for Ennis Hospital should include the restoration of an ED?
Well, she did say she'll be looking at services in the Ennis Hospital that needs to be upgraded. She will be looking at those. There's also a new 48-bed unit being built onto Ennis Hospitals, which we're well aware of, which has been announced, and that is in progress at the moment, getting the design and that ready. And I suppose the most important thing is here, she has promised me she'll be visiting the county, she'll be going back West Clare, she will be going to Ennis Hospital, and she'll see what facilities need to be put in there to improve for patient safety going forward and have more facilities in the Clare side. She's concerned about Clare. She did mention about West Clare and North Clare yesterday, the distance that they're away from the Limerick campus. But again, she's taken all that into consideration. As I said, it's disappointing we're not able to Clare, but I think what was achieved yesterday is a major step forward for health services in Clare, North Tipperary and the Midwest region.
Cathal, just to bring you back in, you mentioned, you weren't invited to the Minister's announcements in Limerick while other political representatives were present. You weren't the only Clare representative not there, media not invited or didn't receive an invite either. And we've received yesterday, talking about it, and even coming in now, and they're coming in their droves, texts from listeners giving out, and in particular they feel there's a lack of influence from Clare TDs. We've one saying yesterday, a listener's feeling that the Limerick TDs are running the Midwest and have been for years. Someone else feels there's a lack of influence of our TDs for the dire needs of the people of Clare at government level. Another one here pointing to a lack of influence at the cabinet table. How frustrated are you by a number of elements here? Not getting the invite to such an important announcement, that feeling that you and your colleagues have a lack of influence, and then others who would say that because your parties are running the government, they're behind this decision, that people are texting in feeling that you would have been in the know on this happening. So there's a mixture of kind of views there. What's your take on those particular views, and indeed the lack of an invite yesterday?
So I'm happy to answer some of those. So it's a fact, and I put up my social media. I didn't know that the minister was in town yesterday. I didn't know there was going to be an announcement. And I don't think that's good enough in government. Can I just preface all of that by saying Joe is on the line with me. He's one of the most honourable, decent people I've ever worked with in the council and the Dáil. He's very inclusive. So my criticisms here are not of him or our local colleagues, because I found them always honourable to deal with. But the minister's office, I don't know what happened yesterday, but they didn't invite me or my 5 other Fianna Fáil colleagues in the region. I think media were excluded as well. So it looks like very much a Limerick announcement when it should be a regional announcement. Again, there are positives. It does improve things in the UHL campus. It will alleviate pressure in UHL, but there's that geographical sensitivity here that I don't think was fully grasped yesterday. And I suppose that's where all of our focus, as I said on national radio earlier today, I think the fight for better healthcare in Clare has now to step up several gears in that regard. The media should have been there, Alan, as well. Clare FM, all of the media should have been there. The other bizarre thing, usually TDs, senators, councillors, we get a barrage of emails each day from different ministers officially communicating decisions, announcements, funding of grants, etc. I've yet to receive official correspondence from the minister's office about all of this.
Is this something you're going to be running up the chain? Are you going to be given they're your government partners? Are you?
I have, and I don't want to overdwell on it, because look, it isn't the big story here is the hospital and the sensitivities of Clare, and that's the story, and I want the focus to go back to that fairly quickly.
I understand that, but from the public's view, Carl, it looks like one hand doesn't know what the other one is doing.
Well, I have raised it, and I've let the minister know what I thought about it all, and I've let colleagues in my own party know as well what I think about it all. Can I go back to the issue, because I lick my wounds very quickly in this, and I'm very much like Joe, stepping up to the plate here on this issue. And the yesterday's thing, I think, needs to be sidelined a little bit. to deal with the other aspects you raised there, I do think that I said it many moons ago, I should say, that Páirc Donovan is the senior minister at Cabinet in this region. And I did say to friends of Ennis Hospital and other campaigners, you can be sure that a Cabinet Minister, regardless of which party he or she belongs to, does have a major say in major projects in their region. And I'm sure he very much fought for this, and I would commend him on that. But how do you say in Limerick? I don't know. Would it have made a difference if we had a Cabinet Minister in Clare? I would hope it would have made a difference. So I do have that mixed feeling. I'm being very honest with you here this morning. I do see benefits, but I see a huge amount of concerns, and I think those concerns can only be assuaged by setting out a timeline, a pathway, and investment. The other thing, can I just say briefly?
Yeah, very quickly.
I've heard from my colleague, Minister Jack Chambers, a fine minister, and he's got a really good plan for accelerating stuff. But the government are looking at projects like the National Concert Hall and the GPO site as the projects to test out accelerating projects. I would say that this hospital, above anything else in the country, needs to be the accelerated project. Only then, I think, will people in the Midwest say, you know what, something good is coming here. But if this becomes a National Children's Hospital or something that's way off down the pipeline, I don't think the public or the representatives like Joe I and others will buy into that.
Okay, Joe, I want to ask you about this as well, because, Minister Carroll MacNeill insists that Clare was at the centre of their plans in the Midwest and in terms of this announcement, but not having the Clare media and some Clare political representatives there gives the impression that perhaps Clare wasn't as central to the plans as we here in this county would like. As a government TD, can you explain what's your take on why Clare media and some Clare representatives weren't invited to what was a major, not Limerick healthcare announcement, a regional, including Clare healthcare announcement?
I'd agree with you, Alan. It was a regional healthcare announcement. That's what it was yesterday. Unfortunately, I had nothing to do with the invitations of who came yesterday. I actually got a phone call on Monday evening to say that it was going ahead Tuesday morning. That's all I got on it, to be honest with you. That's all the invitation I got. But again, what's important here is, since I got elected to the Dáil, I've been fighting hard to get improvement to health services in Clare, in North Tipperary and in the Midwest region. And in fairness, all government bodies, all cross-party in the Midwest region, we sat down to see what we could achieve to improve those services. And we've worked with the Minister on it as well as a team. As I say, the HIQA report said close proximity to UHL. This site has been earmarked now. It is purchased and it is ready to move the thing forward. It's badly needed to improve the health services. And I think now, if we're working together, Clare, Midwest region and North Tipperary, we can achieve a lot for the people living in those areas by improving our ambulance services, as we've mentioned earlier on, and the air ambulance could be looked at. But the most important thing is the people have proper services, easy access, get in and get out. I've heard a lot of people complaining about not able to even get into park in UHL. Getting in there is a problem, and I held the park, been late for appointments and that. People don't deserve that. They deserve proper facilities, and I think we're in a good position now to move forward and deliver these for the Midwest region. Like what you said, Alan, it's the Midwest region.
I do need to wrap up shortly, but Joe, I do want to ask, when you got there and noticed the lack of other colleagues from Clare and indeed lack of Clare media, was it something you mentioned to the minister or other representatives there, or was it anything that anybody mentioned? Given it was a major regional announcement.
It was a major regional announcement, and I was concerned. There was a representative there from the Clare champion that was there, in fairness. I was sure the Clare FM and other bodies would have been invited, but unfortunately I got there at 9 o'clock. The minister was there at 5 or 10 past 9, and there was really no time then to go making calls and see what was going on. So I only went on the phone call I got on Monday evening. Okay,
just to finish with you, Colin, and very quickly, look, this seems to be the side. So I guess next thing is timeline. The minister says the hospital with second ED could emerge within 10 to 15 years. We always talk about big projects overrunning time-wise and budget-wise. We know the Midwest, Limerick, Clare and North Tip needs another hospital as soon as possible. How important is it now that we're not waiting a decade and a half, even longer, for this hospital to be completed and up and running?
Yeah, we need acceleration. 2009, the decision to wind back Ennis, Nenagh and St John's was a failure. Should never have been voted through. We now have a new departure here. There's mixed feelings on it, but we need to absolutely accelerate this. This is the project, as I said, to drive on. I don't think 10 or 15 years, quite frankly, is acceptable. I think we could and should do this a lot quicker, and I would point to the example, I think it's been mentioned on your show in the past, Alan, the Bantry General Hospital, which opened in Limerick on Monday. An incredible facility that was conceived as an idea, built, commissioned, opened, all within about 2.5 year period. So it can be done, and I think let's put the National Concert Hall and the GPO aside for a little while. A new hospital in this region needs absolute acceleration, both in terms of financing, commissioning, and building. And I think that's, but we're not going to take the focus off the needs of Clare, and I think there's a risk that could happen here, and I think that needs to be foremost in our thoughts. How does this get ramped up? And I've been on to the Taoiseach and the Minister for Health. The battle is only going to ratchet up from here on, I would say.
OK, we do have to leave it there. My thanks to Cathal Crowe and Joe Cooney for joining me.